Good morning, everyone. Welcome back to our Wednesday Wellness webinar. For today's topic, we have HIV and AIDS. I am Mary Casabuena, your speaker for today. For our discussion outline, we have the overview, how it is being transmitted, the symptoms, stages, diagnosis, treatment, and how it is being prevented. So HIV, or what we call the human immunodeficiency virus, is a virus that attacks the body's immune system. So if HIV is not being treated, it will lead to AIDS, or what we call the acquired immunodeficiency syndrome. HIV, it attacks the immune cells, or what we call the CD4 cells. It is a type of cell or white blood cells that circulate in detecting infections throughout the body. So once ito nag-infiltrates ang CD4 cells, it will create more copies of the virus. With that, it will destroy the cells and it will reduces the body's ability to combat infections and diseases. So with AIDS naman, ang CD4 count is fewer than 200 cells per cubic millimeter. So what is the mode of transmission of the virus? So we have what we call an unprotected sex. So because doon sa vaginal fluid and blood, yun ang mga carrier ng HIV virus. We also have the sharing of needles. So if someone has HIV at nakashare ka ng needle, so there is a possibility na magkakaroon ka because that's the mode of its transmission. So another transmission is through blood. So nakukuha ito through transfusions, blood products, organ, and tissue transplant as well. So for those mother to baby, so during the pregnancy, during birth, and breastfeeding. Tattoos and body piercings, these are the equipment being used. So for those people na fan magpa-tattoo, make sure na before gagamitin sa inyo, it was being sterilized already. So sa workplace naman, it is very much common to those people who are working in the hospital, especially yung mga medical people. So for the symptoms, it is a flu-like symptoms within 2 to 4 weeks after nagkaroon ng infection ng isang patient. So with these symptoms may last for a few days or several weeks. These are the symptoms. So we have the lymph nodes, nagkakaroon ng night sweats, mouth ulcers, rash, of course, fever, and chills. Nagkakaroon din siya ng rash and muscle aches. But these are just symptoms. To make sure na ang patient may meron talaga siyang AIDS, we have to have a consultation from the doctor and have yourself tested with laboratory. So these are the stages of HIV. So we have stage 1, stage 2, and stage 3. For the stage 1, ito yung tinatawag natin na acute HIV infection. So in here, the patient have large amount of HIV in the blood, which means very contagious na siya. Nagkakaroon ng flu-like symptoms. So some not feel sick right away. So if you have an exposure to HIV positive patient, so it is better that you have also yourself get tested. So another one is the stage 2, or what we call the chronic HIV infection. So it is called a symptomatic HIV infection. HIV is still active but reproduces very low levels. So that's why it's a symptomatic, wala siyang symptoms or get sick at this phase. Without taking medication, this period lasts longer and some may progress faster. So it can also transmit HIV in this phase. So yung HIV viral load ng isang patient increases and CD4 decreases. So ang tendency is mag-move siya into stage 3. And if yung pasyente na merong HIV is not taking the medication religiously, eventually mag-move talaga siya sa stage 3, which is what we call the acquired immune syndrome or AIDS. So in here, this is the most severe phase of HIV infection already. So it badly damaged the immune system of the patient. And then yung CD4 cells counts, nagdi-decrease siya or develop into opportunistic infection. So it means to say that opportunistic infection, it means to say that the patient has a low immune system, so prone na siya magkakasakit, and then nagkakaroon na ngayon ng high viral load and very infectious na yung patient. So without treatment, people with AIDS will survive about 3 years. So what are the diagnoses of this? So we have antigen test, the antibody test, and the NAT, or what we call the nucleic acid test. This test, ginagawa ito by drawing blood from the vein. As you see in the first picture here, so anticubital area siya kinukuha. For the antigens are substances of HIV virus itself, are usually detectable. So it takes weeks to months for antibodies to become detectable. For the antibody test naman, antibodies to HIV blood or saliva. Antibody test can take 3 to 12 weeks after the exposure. For the NAT or the nucleic acid test, so this test look for the actual virus in the blood. So tinitingnan doon yung viral load sa blood. So ito yung test na ginagamit if the patient has a contact sa isang positive patient. So for the treatment, we have for the HIV treatment and for the AIDS. So mga medications ang ginagamit dito. So for the HIV, we have ART. As we all know naman that currently there is no cure for HIV or AIDS. So once nagkakaroon ng infection, so your body can get rid of it. So for the medications, as what I mentioned earlier, we have the ART or the antiretroviral therapy. Itong therapy na to, it is a combination of 3 or more medications from several different drug classes. So when taking this medication, naglo-lower siya ng HIV sa blood ng isang patient. So we have first the NNRIs or the non-nucleoside reverse transcriptase inhibitors. Ito yung medication na nag-turn off ng protein na kailangan ng HIV para makamake siya ng copies into the blood. So example of this are the Sustiva and Idurant. We also have the NRTIs or the nucleotide reverse transcriptase inhibitors. These are the faulty versions of building blocks that HIV needs to make copies of itself. Example of these are Ipivir and Retrovir. We also have the PIs or the protease inhibitors. So, ini-inactive niya ang HIV protease. Ito siya yung another protein na kailangan ng HIV para makakopy siya of itself. So, we have Resista and Kaletra. Lastly, we have the integrase inhibitor. So, dinidisable niya yung protein na tinatawag natin na integrase na kailangan ng HIV para maka-insert siya sa genetic material into the CD4 T cells. So, we have the example of this is TVK. Then, for the AIDS, we have 2 kinds, the NRTI or the nucleoside reverse transcriptase and the protease inhibitors. So, for the NRTI, the nucleoside reverse transcriptase, ini-interrupt ng medication na to yung virus para hindi siya makaduplicate. So, we have Emtrivia, Ipivir, and Retrovir. For the PIs or the protease inhibitors, ini-interrupt niya yung virus in replication so that hindi siya magagamit into the last virus cycle. So, we have Norvir, for example, of this medication. So how it is being prevented? It is very important that we have to take precautionary measure. So kung kaya lang naman, we have what we call the abstinence. Then before engaging into it, so you have to use condoms for protection. Also, we have the PrEP or pre-exposure prophylaxis. So ito yung medications na binibigay dun sa mga taong at risk for HIV for prevention. So it is highly effective in preventing HIV. We also have a PEP. For this one, it is yung tinatawag natin na post-exposure prophylaxis. In taking this medication para ma-prevent natin ang HIV after a possible exposure. So it should be used in emergency situation and must be started within 72 hours after for the possible exposure to HIV. So of course, from mother to baby, you have to have consultation first of your partner for HIV, and then if the patient is already positive, so you have to talk to the doctor for planning your pregnancy, and taking medications also is a must. Of course, we don't have to share needles as much as possible. Yung mga nagpapatattoo, we have to make sure first na na-sterilized muna yung mga gamit or equipment before siya magamit. So that ends my presentation for today. Thank you for listening and have a great day. Bye!